Hello everyone. Now we're going to explain how to use the Tofflemire matrix system. Okay, this is the Tofflemire matrix holder. If we check the end of the holder, we'll find a closed part, and on the other side there is an open part. The closed part should always be placed occlusally. Why do we have to place it occlusally? Because if we place the matrix like this and try to seat it, it will never slip. But if we place the other part, which is the opened part, it could slip. Okay? So if we're placing it like this and applying a little pressure, the matrix could slip. First of all, I have to unscrew the tightening screw, which is the small part down there. Now it's free and we can put these parts together and we can move this as we like. And here's the Tofflemire matrix band. When we put the two ends together and look from a side view, we'll find that it's flared occlusally while it's constricted cervically towards the cervical constriction of the tooth. So we have to place the flared part occlusally with the closed part of the metal matrix holder. We place the matrix through the two parts at the end, like this, and leave a small part here for the tightening screw to tighten it. But we have to know something. If we're trying to place the matrix like this, the metal part will keep bumping into the tooth here, so it won't be placed easily. So we have to change the direction of the matrix either to this side or to that side. But we also have to know that the holder should always be pointing forwards with the face, and the holder itself should be placed in the buccal part of the tooth, towards the buccal part of the tooth, because if the patient closes his mouth, he shouldn't close on the matrix holder. So it should be always buccally and pointing forwards. So here we have to change the direction of the matrix to come out of this part. So we will support this part and move it like this to come out from the side. Then we should start tightening the tightening screw until it's very tight. During this step, if we notice any movement between these two parts, then the matrix is not functioning properly. We have to change it. After tightening it as much as we can, we should start putting the matrix in place. Start through the proximal part, pass it here like this, then guide the rest of the matrix till it's fully seated. Okay? After it's fully seated, I should place my finger to do some occlusal support, then start tightening the adjusting screw, which is the bigger part here. We should tighten it until we have a stable matrix with no movement at all. So do your best to tighten this part. Okay, here it's very tight and there is no movement. As we can see it from the side, we'll notice that there is a gap between the teeth. That's because the Tofflemire matrix is not a pre-contoured matrix, unlike the sectional matrix system and stuff. So here we have to do burnishing of the matrix. But before we do the burnishing for the matrix, we have to place a wedge to seal the gingival seat. Normally we place the wedge from the lingual embrasure because it's wider than the buccal one, but we can place it from the buccal embrasure as well. So here we place the wedge, okay? If we didn't gain a full seal at the gingival seat, we should switch to a larger sized wedge, or we can wrap Teflon around this wedge to help it seal the gingival seat. Then use a large board burnisher like this one and start applying pressure from the inside against the adjacent or neighboring tooth. Do your best to burnish the matrix. Then check the proximal part. We almost have a contact here. It needs much more burnishing. Okay. And now we're ready to place the restoration. Okay, to remove the matrix holder, we can untighten the tightening screw and remove the holder, and then remove this part of the matrix. Then finally remove the part at the contact area, and of course remove the wedge. Thank you.